Ujala. I'm teaching endoscopy program at Ames Education. And here is my student, Giovanni. And today we're going to perform upper endoscopy. Basically, upper endoscopy is you're going to take a look inside the patient's stomach, duodenum, and esophagus. And we can take some biopsies. And today, while we're doing this procedure, Giovanni is going to be assisting me. Okay, so to perform upper endoscopy, we need a flexible upper endoscopy scope, which is a very flexible, and we're going to use the suction and the air buttons. This is the Biopsy Force, the biopsy port, and basically Gio and me is going to take a look into the patient's stomach and perform some biopsies. And biopsy pathologies is going to be stored in this little jar. It's called formalin jar, and we're going to send this out to the pathology. And when we take the biopsy, we're going to use the biopsy forceps, which is Gio showing you. And Gio, if you can read how big is the forceps?
The biopsy forceps is about 240 centimeters long, with a conclusion of the actual forceps of 2.4 millimeters.
And if you can open it for us. And when we open this biopsy forceps, we want to make sure it stays away from everything. We don't want to contaminate that biopsy forceps. And biopsy forceps has a needle, so whenever you touch the forceps, you make sure it's closed, and we want to make sure when we put it in the scope, it stays closed. Perfect. Now we're gonna open this one. And now Gio, can you open? So when we open the forceps, you can see the needle. This is where we're gonna take this is the needle where it's gonna take the biopsies. You can close it for me and roll it back. Okay, so let's see. Patient is already in a deep sleep, and assume that we are putting the scope inside the mouth. And the scope is going to be stable in the mouth with patients. And Gio, can you have the forceps? Thank you. So basically my job, I'm putting this biopsy forceps to the biopsy channel. And I'm going really slow right now. And it's going to, if you see, it's going to come out from the scope soon. I want to stop when I feel this black arrows, marks. That means come closer. And my forceps is all the way closed. Can you open it? And when I have to take a biopsy, I'm going to tell my assistant to close now. He's going to close. And my duty is to take a bite. Pull it. And now open it. Close. Take the forceps. And now he's going to save that biopsy into the jar. And pick up the okay, thank you. So here we look first portion of esophagus, then stomach, and then duodenum. So esophagus has a 3 portion. If you name it for me.
Upper, mid, distal.
And then we go to the stomach. So if you can name stomach.
Fundus, antrum, and body.
Correct. And duodenum. And basically this procedure takes only 7 to 10 minutes.